Welcome to the Pain Relief Path podcast, where I dive into the vast world of chronic pain with the occasional help from knowledgeable guests from diverse disciplines that impact your chronic pain. I am your host, Dr. Pan Zhang, physical therapist turned chronic pain coach. I'm here to educate, empower, and encourage you to find your path to a pain-free life. Thank you for listening. Enjoy. Welcome back, everyone, to Pain Relief Path. My name is Dr. Pan Zhang, and I have an awesome, super special guest on today. Her name is Dr. L.J. Johnson, and she is a certified women's health and nutrition coach, and she focuses on people with just women's health issues, right? So irregular painful cycles, infertility, insomnia, weight gain, endometriosis specifically. LJ, I'd love to welcome you to my podcast. And if you want to introduce yourself to everybody a little bit more, I'd be grateful.
Thank you. Thank you, Dr. Pan. You already rolled out the red carpet. I am super duper excited to be here. I know I was just talking to you about how I get all excited. I'm like, do I sit? Do I stand? Do I do jumping jacks? What do I do during these podcasts? Lord knows. I try to keep right by the mic so that you guys can hear me. I'm super excited to be here, full of energy, ready to rock. I am L.J. Johnson, the holistic hormone expert specializing in endometriosis, PCOS, and fibroids. All of that not so sexy women's health stuff that we sometimes normalize as we talk about pain and normalizing pain. Those are my areas of expertise. And yeah, I'm just excited to be here to kick off my week. End of September, great energy, ready to step into the fall, but also ready to get my audience in the driver's seat of their health.
That's fantastic. And I think one of the reasons why I'm really excited to talk to you is because, endo and fibro, those are areas that I'm actually just not super familiar with, actually. I know chronic pain for sure. I help people get to where they want to be, but the specifics of like endometriosis and fibroids and people with fertility issues, all that fun stuff, I'm just not super well versed about. So I love this podcast because I get to talk to experts like you and I get to learn a bunch. So it's fantastic.
I know, right? We learn from each other.
Yep. I love it. I'd love to hear about your story a little bit more. So what drove you to be a women's health coach?
Well, I have to be honest, I have been in the women's health and fitness industry for years, but what really caused that biggest shift in my business to where I left working on fitness and the aesthetics of the body and being lean and all of those things, and fitness is very important, don't get me wrong, but when my own health started to shift and the stuff I was sitting on stage or standing on stage and, putting out there on social media stopped working for me personally, I was kind of like, because I'm one of those people like, I got to be walking the walk and talking the talk. I'm not going to say one thing and then do another. So for me, it started to not add up, right? I was not getting those health and healing wins by focusing on nutrition and fitness only. Suddenly, my body was in this hormonal, hell, this hormonal chaos where I was chasing a diagnosis. My body was falling apart. I was either on stage killing it, doing events, fitness events of, 5, 10, 15,000 people, or I was on Mattress Island for 10, 15, 20 days at a time, not being able to move, not being able to take care of my family, not being able to go to work, having to answer why I am an amazing employee, but did I mention I can't come to work on a consistent basis because I have this unreliable body. So for me, it was really shifting out of, not just going into entrepreneurship, but figuring out like, hey, some of the mindset and the beliefs and the things that I've been out there telling people, here's the deal, they're not working for me. So that's problem number one. So then I was like, I need to go get some re-education, but I also needed to devote more time to my healing journey to literally figure out like what the heck was going on. Now, for me personally, that was being diagnosed with endometriosis. And so combined with all the other chronic illnesses and everything that I had, it was overwhelming. I had to really just pivot my world. And as I started to heal myself naturally, that's when I started to figure out like, this is the time to shift my business, right? I don't want to be talking about stuff I'm not passionate about. I don't want to be telling people stuff that's not working for me. I mean, there's nothing more humbling than going to a conference and people like, oh, when are you due? And you're like, oh, actually, this is my endo belly. I'm just bloated. Like, I'm just having some health issues. I'm not due. I'm not pregnant. Like that's very humbling to where you're like, okay, I got to get my body where I can show up on a consistent basis, where I'm not in flares, where I'm not in chronic pain. And so that's what really shifted my business because of my own healing journey. And then, I mean, also as a woman of color, I noticed there were lots of other women of color in this disparity that were chasing diagnosis, that did know what was going on, that was normalizing pain. And I was like, I think this is my new calling. I think this is going to be my thing, moving forward.
Yeah, that's fantastic. And I think a big part of this is one of the things that I heard was things shifted for you. And it sounds like things just changed. What do you feel like changed so that you started kind of delving into a little bit different approach for your body and your mind and spirit?
My biggest shift, like I said, it was knowing that what I was doing was no longer working. I am results driven. I
Mhm.
will do whatever it takes. I will go to the moon and back if that's what I need to do to heal
Mhm.
my body. But my hormones shifted, right? Let's talk about some of the things that
Okay.
we did in our
Yeah.
20s. The whole, oh my gosh, I have a wedding in 3 weeks. I'm going to water fast. I'm going to do some more cardio. I'm going to slide into this black dress in 21 days, right? All that little stuff was fine in the 20s. But baby, when I rolled into the 30s, some of that, habit hacking I'd been doing, my hormones caught up with me. Some of my daily routine, the stress management, the anxiety, all of these things, my lack of nutrition. And this is real talk. As a nutritionist, my nutrition had gotten to where I was in that mindset of, I don't want to be fat. I don't eat fat, right? Some of those things. So I was not bringing in healthy fats. I was doing a lot of, once again, traveling the world, taking care of everyone else, telling them to eat 3 meals a day, giving them all the nutrient dense meals and living on protein shakes myself, right? Like it was really like a slap in the face of what I had been doing no longer worked. And then it started to take a toll on my career. It started to take a toll on my, me parenting. I was a single parent of 2 children. The days you can't get out of bed, it's kind of hard to be a parent, right? Maybe every once in a while mom doesn't feel well, but when mom is like, on narcotics, on pain pills, 24/7, you're trying to explain to your ex-husband and a judge and everyone else that you're an amazing person, but you got this weird body and they're like, oh, you just have a period? Because everyone has a period. And it's like, well, it's not really a period problem, what I'm dealing with, right? Like it's very humbling once again to have to explain. And so for me, everything started to crumble. I was hiding in plain sight and it was working for a while. And then all of a sudden my foundation started to slip away, right? I was having issues with, parenting, the parenting plan that we came up with, okay, the kids are coming to my home, at that time, or I was the custodial parent, but I couldn't get them dressed for school. I'm having to text neighbors, right? I'm not being able to go into work. Then I had my own business. And let's be honest, as an entrepreneur, in the very beginning, you're the main talent. If you don't show up, if you're not doing podcasts and, out speaking engagements, and if you're not engaging with your business, there's no money coming in. So as an entrepreneur, it's like I had this amazing business, but I couldn't show up on a consistent basis. I was having to turn down, speaking engagements. One of my worst, speaking engagements is I showed up to the event and then the morning of, I'm in the actual hotel with everyone waiting for me downstairs. And guess who was stuck up in bed with an endo flare, right? Like those types of things, I was like, okay, this ain't working, right? Like we gonna have to really go back to the drawing board because it was affecting me socially, financially, my mental health. It was touching everything. And I think that's what people sometimes forget is that chronic illness, even the more invisible illness, it touches everything. And we like to just silo it to physical pain, if I can just get rid of the physical pain. But, I just did a post this morning on Instagram. It's not just the physical pain, it's the mindset, it's the mental health, it's depression, anxiety, the financial, like for me, especially as a business owner, like you're only bringing in so much money, but then these, medical bills are, titrating up, they're going up, 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 and up. Your insurance isn't covering everything. Not to mention, I will just be honest now that I think about it, it was also like, what's going on here? Like, I'm a doctor out here helping other people and I can't even help myself. Like, what is really going on here? Like, you just feel like a hypocrite. You're like, I got to get some healing wins so that I can help others heal.
Yep, totally. And to your point about pain not just being pain, that's my whole jam. I'm very much, mind, body, spirit, like your life needs to work for you. So I am 100% on board with that. I'm curious. So it sounds like your endo started becoming problematic kind of recently.
Absolutely.
Yeah.
Yes.
What did those symptoms look like for you? For people who might be experiencing weird different shifts in their body and they're not really sure what it looks like. What did it look like for you?
Right. I will start by saying that endo is not a period problem. It is not a reproductive issue. It's not just, oh, you have bad periods, toughen up, buttercup, you'll be okay. It's anything but that. And so for a lot of people, they think it's period pain, cramping, okay, maybe a little painful sex. But for me, at the age of 14, I was having horrible murder scene periods, like bleeding through my outfits, having to change clothes. Let's talk about it. 14 years old. You're already freaking out. You don't know your body. You're trying to be like, I'm just trying to keep up here. Like I got boobs coming in, all these things happening. And then I'm like, passing out. I'm having hot flashes. I would be passing out during my cycle. As I got older, it turned into chronic systemic inflammation, which for me looked like a lot of nerve pain, a lot of joint pain. Even though I was super athletic, I started getting inflamed. I started putting on weight. And I hate to say that, but even in high school, they're kind of like, oh, you just need to run a couple more laps, or, oh, probably, and I hate to say it, even with, children at a young age, they're like, well, cut back on the carbs, do this, that, and the other, because you're chasing symptoms, right? My body was inflamed. I had a lot of breathing issues because I had those lesions in my diaphragm. So, exacerbation of the asthma. And then it was just weird things. I was that person that was always sick. I mean, I say it lightly, but it's like someone would cough 10 classrooms down and have the flu, and somehow I'd have the flu. Like everything that went around, my immune system was pretty much non-existent. No matter what I did, no matter what my parents fed me, no matter, all the prayer and water and meditation and affirmations in the world, my immune system was crippled. I had chronic sinus infections. As I got older, I mean, at the age of 43, I've had 4 sinus surgeries. And so every time they were going in, they were cleaning out polyps, cleaning out lesions. There was always systemic inflammation, a lot of pelvic pain for me. And so when I say pelvic pain, not just, oh, my period's coming, let me get a heating pad. I'm talking about 24/7 bleeding outside of my cycle, pelvic pain outside of my cycle. I remember sitting in college classes feeling like there were pins and needles dancing literally on my bladder, always. And it's like you go to the bathroom, nothing's coming out, and you're like, what's going on? Right. And it's also this thing of like, I'm feeling like I'm crazy because my body's doing these things, right? And it didn't help going to the doctor, because as soon as I said period pain or bleeding or that, they're like, you know what, LJ, got just the birth control you need, honey. But it's like, as soon as I said that, they shut down all the symptoms. So I had, the inflammation throughout my body, a lot of ENT issues. I started having vision issues, lots of dental issues. Everyone's like, oh, I love your teeth. I'm like, baby, you don't know how much money I have paid to get these teeth where they are. Lots of dental issues, chronic systemic inflammation in my gums, bleeding gums. I was that person, with the overpriced $200, toothbrush, but always needed a root canal, always needed a crown. There was something going on with the enamel of my teeth. Probably, some of it was the pharmaceuticals I was taking. And then also my body was nutrient deficient. Every time you turned around, I had, not just because of athletics, but I had a sprained ankle. I remember getting a high ankle sprain that took almost 2.5 years to heal. I repeat, a high ankle sprain, right? Now, I'm not an orthopedist, but it should not take 2.5 years for a high ankle sprain to heal. But when your ligaments are loose, when you've got the hormonal issues, when you're inflamed, your body doesn't properly heal. I remember having a conversation with my doctor, and he was like, I just wish it was a broken leg. Because he's like, we could have just had surgery and put the screws in the rod and you would have been better. But he's like, this high ankle sprain, like my body was always being injured. Lots of joint pain, crazy rashes. One day I'd have clear skin. The next day, I'd wake up with, acne, and it wasn't the cute acne. It was like the under the skin, hormonal acne, which nothing would help. Not the stuff you can cure with the pimple patch and Curology. It was like, I was on the strong stuff. It was wearing down. So for me, it started as what we would call like a bad period or a rogue period, or, oh, you're just a heavy bleeder. But I will say I didn't address it then. So all it did was, that was the first check engine light. And that's how I describe it. Your body gives you check engine lights. That was the first check engine light for me, starting at the age of 14. By the time I got to 16, by the time I got married at 19, by the time I had 2 children, more and more and more check engine lights. It just, like every system in my body. I was always having kidney issues. There was always something wrong with my gallbladder. Like, I felt defeated, right? But then on the other hand, I'm Dr. Johnson out here helping women, doing all these amazing things. And I'm like, my body is like falling apart on me. Like, it was horrible. And looking back, I wish I would have known. I always, the people are like, what would you do differently? Gosh, if I would have known someone like myself when I was 14 years old, when I was 16, when I was 19 and married and having painful sex, I needed someone to tell me that that wasn't normal, right? I needed someone to tell me that I wasn't weak, that I was feeling pain, that I wasn't because I was a weak woman, that I was, just not fit to be a mother, that there was something really going on in my body. And it took me 16 years to get the diagnosis, which is why I talk so much about it now, because I'm like, even if one person heard this podcast, like if I never made another dollar, who cares? If one person heard the podcast and was like, oh my God, I'm not crazy. Now I can go to my doctor and be like, hey, these are the things happening. Maybe it's not something they want to help you with. They can refer you out. But it's like, if only one person, that can change absolutely like their entire quality of life.
Right. So I wanted to ask you about that. So you've been struggling with this since you were 14, basically since puberty hit, it sounds like.
Mm-hmm.
So what was your journey to get your diagnosis? Because I mean, I work with people with chronic pain, and their medical journeys are sometimes horrifying, to be quite honest. So I'm curious how your journey was to find your diagnosis and find maybe doctors who understood and listened and helped.
Right. I have to be honest, and not just as a woman, but as a woman of color, it was a
Mhm.
journey. Even now, I'm dealing with some issues with my digestive health. And I recently had to let my digestive health doctor go, and he's been with me for 10 years. But it was really interesting. And I'll add this in before I answer that question, because I think it's important. You have to find a doctor that listens to you. And I love my doctor, with GI doctor. I've had him for years. But the last time I had a small procedure, he made a comment to me, and he's like, you know what? You just know too much. And I'm like, now, I have to pause for a second there. I'm like, how can someone be too aware of their body, right? I may spend a 10, 15-minute appointment with you. Maybe this procedure took 30 minutes. I have to deal with this chronic invisible illness 24/7, right? So just because you feel like I'm over advocating. I mean, once again, not to turn it into why I fired him, but I found someone that listened. But I think after the length of that, relationship, it got to where he was just like, you're just too knowledgeable about your own body, because I wasn't just buying what he was serving me. And so for me personally, that's why it took so long to get a diagnosis, because I couldn't find doctors that would listen to me. I wouldn't find people that would believe me. I was even, as a mental health professional, it was like, okay, maybe it's in your head. So then I remember sitting in the car one day. I went to Kaiser. My OB was just like, we've done everything we can. She's like, you won't take the birth control anymore. You won't do this. You won't do that. So she was just like, if you don't want to take these meds and you obviously don't want to get better. And it was explaining to her in tears that I was in pain. I didn't want pain meds. I didn't want any of those things. Like, I needed to know what was going on with my body. I needed to know why I couldn't go to work on a consistent basis. I needed to know why, I would be teaching conferences and suddenly have brain fog and couldn't even remember my own social security number. Like, I needed to know what was attacking my body. And so it took a long time to find doctors that listened to me. I mean, I've got an amazing team right now. Like I said, I'm in the works for a new GI doctor. So if you hear this and you're an amazing GI, let me know. But it took a long time to find a team that listened to me. It took a
Mhm.
long time. Many endocrinologists, and for many of us that have chronic illness, and this is one thing I'll kind of throw in, you have to have a team. It's not just going to be you and your primary care and you and your OB saving the world. I think those two people can be integral to getting that foundation going. But typically, you're going to need a GI doctor. There's going to be some GI issues. You're going to need an endocrinologist, because when you're dealing with all of this chronic systemic inflammation, eventually your thyroid's going to be like, hey, I'm going to take a break because there's too much going on. Your endocrine system's like, help, help, help. You may need a podiatrist. You may need a rheumatologist, because endometriosis, which we'll define very quickly, is chronic systemic inflammation throughout your entire body. It is not a reproductive disorder. It's not just you being weak and having a horrible period. These lesions are hormonally driven, and they're outside of your uterus, right? And I know we'll talk about some of the misconceptions, but that chronic systemic inflammation affects your entire body. I guess it can infect too, if you think about it. It affects and infects everything. So you have to really have a good medical team. For
Mhm.
me, I didn't really come across my, A1 team probably until my late 20s, rolling into my 30s when I got the diagnosis. And
Mhm.
to be honest, I mean, I joke about not being on Dr. Google, but back then, that's kind of how it happened. I really and truly, not to toot my own horn, I diagnosed myself. That was back in the day where you didn't save trees and you printed all the paper and took it to the doctor and you're like, look here. You're like, I think I found what's going on. And I remember my doctor's like, okay, yeah, maybe you're onto something. Cause they're kind of like, we've done everything. Sure enough, we started digging deeper. And that's how I got the diagnosis of endometriosis. It was a lot of research on my own, a lot of 2 a.m. with Dr. Google, not because 2 a.m. is my favorite time, but when you're in chronic pain and you can't sleep, you got nothing else to do but come up with solutions, right? And
Yeah.
sometimes those solutions are, helping you in your journey. For me, I spent a lot of time, I date myself, I was on Baby Center, right? We didn't have all the fun podcasts and, Clubhouse and Instagram and all that. So I was in other forums with moms like, hey, are you passing out during your period? Or hey, like this is what's happening to me. And that's really how I found my diagnosis almost. And really for a lot of people, I will say a diagnosis of exclusion, right? It wasn't arthritis. It wasn't lupus. It wasn't MS. Like I'd been through all the testing. I mean, I've had 5 colonoscopies and I'm 43 years old. So when I say we had dug into everything,
Literally.
aside of them admitting me to the psych ward, and then, once they figure out there's something wrong, they're like, you know what? I guess you're not crazy. And you're like, well, thank God, but what about the people that can't hang on for 16 years? And stay strong. Now I'm a strong person, but I'm going to be honest. It wasn't just always climbing up the mountain and on top of it. Like there were days I felt defeated. There were days I questioned my own sanity because I'm like, they're telling me there's nothing wrong with me. I feel like there's something wrong, but I'm like, maybe. But then I'm like, I did miss all last week of work. I couldn't walk. Like, I'm trying to remember, like, was this all in my head? And because that's what you get is that very dismissive. And I think once again, as medical professionals, we do the best we can, but there are some medical professionals when they don't know, they won't just be like, hey, LJ, I don't know. Let me refer you to Dr. Whoever, or, let me bring in someone else. They're just kind of like, I'm going to find the answer. And, if I don't find the answer, then there's just nothing wrong. And you're like, but I can't walk some days. When I have my period, I'm having nosebleeds. When my period comes, my left side is filling up and it's like a balloon over there, like there's other things going on. Sometimes physicians are just not willing to kind of put down their pride and be like, you know what? I don't know what the answer is. I got to bring someone else in.
Yep. I agree with you 100%. And, working in the medical field, that is the case, unfortunately, way more often than it isn't, like you were saying. And I think the big issue is that we don't know what we don't know. We just figure
Mm-hmm.
we don't know it. It doesn't exist, which is a huge issue, obviously. How do you feel like after that huge long journey of getting your diagnosis, kind of formally and informally, how do you feel like getting the diagnosis affected you, like physically, mentally, emotionally, just having a diagnosis?
So for me, it was relieving at first because you're like, oh my God, I've been going through hell. At least I know it's not all in my head. But
Hmm.
then it was like that slap in the face of like, well, there's no cure, but you know what? We do kind of have a cure. We can't really fix it, but hey, do you want to go back on the birth control? It was like all the same band-aids I had been given for years, pain
Hmm.
management pills, different things like that. All those same things were just thrown right back in my face. And I remember one of my doctors were kind of like, well, it was almost like, well, getting a diagnosis doesn't help because we just have to do all the same things. For me, it gave me a sense of security and almost just like my mental health to be like, okay, girl, you're not losing it, right? There's actually something wrong. But it was very disheartening because, even for someone that, is on that cancer journey, there's chemo, there's different things. For me with endo, I felt like there was just nothing, it was just like, well, it's just a period problem, and if you don't want that problem, let's just go have a hysterectomy. And then you're like, I don't want to have a hysterectomy. And they're kind of like, well, then I guess that's just where it's going to be. And it's like, I'm having pelvic pain. I mean, I have to be honest, 70% of my current patients have full hysterectomies. They have 0 lady parts, everything missing, still bleeding, still having chronic pelvic pain, right? Because endo's not in your uterus. And so for me, it was good to have the diagnosis, but it was also that slap in the face of like, we really can't do anything for you. Like you kind of just went all these years when you should have just bowed down and got back on the birth control or had another surgery or different things like that. And so It's always, I think for my mental health, it probably did a lot more for me in the beginning. Moving forward, it was just very disheartening because I was like, okay, now I've been chasing this diagnosis and I feel like the list of things I can do are like, an inch or two long. Like there's, birth control again, have a hysterectomy, stop complaining about your period, toughen up, different things like, oh, you have a uterus, that's just part of it. It's kind of like, now what do I do? Which is why I'm so passionate about what I do now, because I was that person where I was like, I've got a life to live. I've got a calling on my life. I'm like, I want to help people. I want to do all these things. Yet I have this body that is unreliable. Like I've got to figure out how to have quality of life despite this diagnosis, which, has no cure. Like that became my biggest driver because I knew what it was like to chase the diagnosis, but to get it and then almost have like no treatment or no help, it was just, even the more it's like you're back at square one. You're like, now what do I do?
Yeah. And so many people on a chronic pain journey are searching for exactly that, which is why I was asking that question. And it's interesting how that diagnosis affects different people differently.
Mm-hmm.
Um, and obviously, we're going to get into how you're helping yourself and helping people in a little bit. But I wanted to talk a little bit more about endometriosis in general.
Mm-hmm.
You are an expert, obviously, both just personally and those are the people that you help. But we already talked about what endometriosis is and your symptoms. And those are, I'm assuming, pretty common symptoms for a lot of people. But who does endometriosis affect typically? I mean, is there a certain age range? Does it happen once you hit puberty? Does it develop over time? How does that work?
That's such a great question. So when it comes to endometriosis, it is no respecter of person. It could be, as I've got my youngest patient at 8 years old, endometriosis could be bothering someone all the way up into their 55 or 60s. It doesn't matter the age, the gender. It doesn't matter your socio, economic status, rich, poor, black, white. I got to be honest, it is not a respecter of person. So when we look at what endometriosis is, it is uterine-like tissue. So I want to just go back to that. It's uterine-like. It's not endometrial lining. It's not uterine lining. So it's uterine-like tissue found outside of the uterus. It is hormonally driven. It creates its own estrogen and progesterone. It is chronic systemic inflammation throughout your entire body. And it is not a reproductive disease. It is not a rogue period. It is not, you just being weak or anything like that. But what I will say is that it does have autoimmune-like factors. And for me personally, and a lot of the people that I work with right now, the autoimmune factors part is the part that still kind of kicks our butt. I know for me, I no longer have, painful periods, painful sex, the bladder pain, like all of these things that I suffered with that was debilitating for me for many years. I no longer experience that. However, I still very much deal with the autoimmune-like factors. So that immune system that always needs that additional, support, that immune system that, may have me wearing a mask or whatever out and about when other people are like, oh, everything is fine. But for me, I have a more compromised immune system that wants to inflame at any moment. Mm-hmm. So I have to kind of go out of my way to make sure that I'm decreasing those inflammatory markers.
So when you're saying like uterine-like lining, so that's like uterine-like cells and tissue found outside of your reproductive system. And is that what's inflaming? Is that what's causing some of the autoimmune issues and inflammation?
Correct, because it can be on your bowel, it can be on your bladder. For some people, it can be up in the sinuses and the nasal cavities. So you're having like that bleeding, the nosebleed. I know for me, I spent a lot of time in Colorado. So when it happened, people were like, oh, it's just because it's dry and you're up in the mountains. And I'm like, no, I feel like every time I have my period, my nose is bleeding. Like it's like something's going on, every time I'm bleeding outside of my period. So yes, those lesions can be anywhere. They've been just found about anywhere, lots of time it's going to be on the liver, the spleen, the appendix. A lot of people also, I just thought I would mention this, have things like their appendix removed, their gallbladder removed, etc. And then they still have issues. And then all of a sudden, their doctor's like, oh, or they find it when they're doing the pathology from the surgery that it's endometriosis. A lot of times also, if you're having, breathing issues, asthmatic issues, that diaphragmatic endo, it will affect your, during your cycle and sometimes outside of your cycle, you'll have that inflammation. It's because once again, those lesions are outside of the uterus, which I think is the best time to say that one of the biggest misconceptions, is let's yank out all your lady parts, we'll rip everything out and you'll be good to go. But here's the deal. it's uterine-like tissue found outside of the uterus. So just removing the uterus and the tubes and, ovaries and all of that, that's not necessarily going to cure your endo. Now, it can provide quality of life if you're, anemic and you're having bleeding and all of these things, but it's not going to be a cure for endometriosis.
Gotcha. And I mean, when you go through hysterectomies and those types of surgeries, one, it's a huge shock to the system. As a
Mm-hmm.
physical therapist, I mean, I've had women who've had hysterectomies like 10 years ago, and they still never feel back to normal. And two, it really throws your hormones like all sorts of wacky. So if
Mm-hmm.
endometriosis is already a hormonal issue, then how does that affect having a hysterectomy? How does that affect your symptoms then?
Well, like I said, for some, it can provide greater quality of life. If you're having a lot of bleeding, a lot of cramping, maybe you're really anemic, you can't get your nutrient levels up, having the hysterectomy can help. But I think and it's the way I like to explain it to my patients is, endometriosis is chronic. It's going to be something, it's invisible, it's going to be there. So even though you have your uterus and everything removed, that check engine light, it's just going to move to something else. Then you're going to start having nerve pain. Then you're going to have the pelvic muscles, issues, all of these different things, your vagus nerve, your nervous system,
Mhm.
everything. So even if you have surgically induced or medically induced, because I was told, I'll just put it, the lie that if I go into menopause, it'll turn off my endo. Well, if you've been bleeding every second and miserable and in pain, you're like, sign me up, turn it off, let's
Mhm.
go. But what I found is turning off my hormones, turning off my period, didn't cure the endo. For me, I had exasperation of symptoms, not to mention even, 10 years later, I'm still, working on bone density issues, working on nutrient deficiencies, all of those things. And so if you do choose the hysterectomy, once again, everyone's healing journey is different. Don't beat yourself up, but you really have to decide that you're going to work with someone to bring those hormones back in if that's what you need, and doing all the other lifestyle changes. May that be changing up your nutrition, changing up your fitness, detoxification, all of those things are very important. And I think when you're in that pain, because I've been there, you just want the pain to stop now. You don't care what the side effects are, this, that, and the other. But when you're dealing with endometriosis, it is chronic. It's going to be a lifetime journey. So you really have to, kind of slow down sometimes and bring in modalities that are going to bring the least amount of side effects, is the way I would put it.
Yeah. So I know you obviously work with clients who have these issues. What do you feel like are some of the more common struggles that your clients are dealing with, whether it's symptomatically, emotionally, or mentally? What are you helping your clients with the most?
Physically, I would say the biggest thing is the GI issues.
Hmm.
Right. And so I'm going to break that down a little bit, because when I say GI issues, you're like, oh, yeah, the bloating, the cramping. Okay, yeah. But I'm also talking about the GI issues to where it's almost revving up or bringing up an eating disorder. So think of it this way. If you're always bloated, you're always cramping, it's 10:47 where I'm at right now. Like if you have a 1 o'clock meeting, let's say you're hungry, you're like, do I eat now and be really bloated before that 1 p.m. meeting? What if I react to the food? What if I'm in, extreme pain? What if I'm in pain because I didn't eat? Oh my gosh, at 11 o'clock, I've got to take my pain med. So we have all of this stuff going, right? So it's for a lot of people, the GI issues, it's not just the IBS, the constipation or the diarrhea, it's the nutrient deficiencies. It becomes an actual fear of food, and food is fuel. And so I'm
Hmm.
really glad we touched on this, because I get very passionate about it and I should talk about it more. It's like, yeah, the GI issues of what we can eat, and, okay, some people avoid gluten, wheat, dairy, different things like that, but it's deeper than that. I mean, it becomes an actual, like, I don't want to say it like an addiction, but it's like an aversion to food. Like you're
Hmm.
afraid to fuel your body because you have no idea what's going to trigger it. So one of the biggest things I work with my patients on is identifying your triggers. What are your triggers? I know for me personally, some of my triggers were nightshades, right? There's nothing wrong with fruits and vegetables, but for me personally, tomatoes, white potatoes, as much as I want to have that big salad with all the color and the peppers, that was not working for me. Even to this day, I've healed my gut a lot more. And so I don't have to be as strict, but tomatoes still kind of close my throat up a little bit. That's just an
Hmm.
inflammatory response, a histamine response my body has. So when we're talking about GI issues, The biggest thing is identifying those food triggers and then also seeing exactly what's going on in the gut. So many times, and I'm sure you've seen it, Instagram, TikTok, all the fun stuff. I love social media, but it's like, take this, take that. What works for me may not work for you and could be a game changer for someone else. And so it's finding specifically what works for your body. And so sometimes that's going to be bringing in some functional testing rather than guessing. Because typically by the time they get to me, you've done all the DIYing and the guessing and what you found on Instagram and Pinterest. You're like, get me to the money. And that's what I want to do, is get you to the money, get you to the relief. So the GI issues are the biggest thing. And then when it comes to the mental health portion, I think it's just, you feel broken. No matter what I tell you, no matter, what, some people are like, I do yoga, I do meditation, but you're like, I feel broken. The other thing with that brokenness is because we feel like we have a body that we can't rely on. It's Monday morning for me. I'm up and about. I've been to the gym. I've emailed you a couple times. Like, I'm out and about. I'm doing it. But when my body was not reliable, I didn't know what Monday morning was going to look like. So it's really hard to have a positive mindset. I did an Instagram reel recently where, it's like things I wish our partners would understand, that chronic means chronic. That there are going to be good days and there are going to be bad days, but it's also realizing that this is something I have to manage every day, and I don't always know what each day is going to look like. And so when it comes to your mental health, it's really hard to stay positive. Another thing, people are like, well, just think positive thoughts. Yeah. Positive thoughts are amazing. There's nothing wrong with that. I think it's very great. But sometimes positive thoughts aren't enough when, I can't go to work. I can't hang out with friends. I have no social life. I can't go to work. Now I can't, buy those extra supplements. I mean, let's talk real talk. Some of this maintenance is not going to be something covered by your medical insurance. And so if you don't have that expendable income to get that extra pelvic PT or to buy that supplement, or, even the things we take for granted, the cryotherapy and all of those things, like those modalities are an additional expense. And it's like, how is someone going to, just think positive thoughts about their situation when they're not even able to cover, once again, real talk, their everyday expenses? Where will they get the money or the resources to, have that, consultation with an excision surgeon, to pay for the surgery that their insurance won't cover, to have that positive outlook, like it's fall, I know for me, I'm like, fall means like Halloween parties and, costume parties and corn mazes and all that. But I mean, let's be honest. There were times I couldn't do any of that stuff. I was anxious. I didn't know if my, freaking uterus was going to fall out, while I was out and about, or the murder scene period, or even like last night, my boyfriend, we celebrated his birthday and went to an NFL game. Like, that's something I couldn't do before because, especially now, you've got to bring this purse that's like the size of a, it's so tiny. I'm like, my pads wouldn't even fit in there, right? And I didn't want to be the person explaining, why I got to bring my EpiPen, my this, my that. Like, I lived in fear, and it wasn't because I was a fearful person. It was just my mental health was broken because I didn't have a body I could rely on, and then I'm looking at everyone else, and I mean, nobody wants to admit it, but we still sit back and we're like, well, what's wrong with us? They seem to be having a perfectly fine life. They have a family, they have a relationship. And so it's finding that we can have quality of life as well. It's just going to look different, right? Someone else may have been able to go and have mimosas all Sunday and hang out with their girlfriends. For me, that's not going to work for my healing journey. So, I had to make some lifestyle changes, but my quality of life is just as amazing. I just had to find what works for me. And I think when you're bogged down in pain, you're feeling dismissed, you feel like your body is broken, no matter what I tell you, you can't eat, you can't sleep. It does get very, very hard to stay positive. And that's where I think working with someone, maybe myself or anyone else, but then also community. Like, you've got to have that community sometimes. It's like, hey, LJ, it is okay to have a bad day. But here's the thing, I say it all the time. You can't sit in it, right? It's okay to not be okay. But we got to then team up with someone to get us strong to pull us through that. Or we've got to decide for ourselves, like, you know what, today I don't feel great and I'm going to give myself grace. But, I'm going to make sure I take a shower today, or I'm going to make sure I do whatever I can for myself. Sorry, that's like my super long answer to that short question. But the GI issues are the biggest. And then the mental health, just feeling defeated and not seeing that there's any hope at the end of the tunnel, not feeling like your body is going to even get you to where you need to be.
I love the long answers because I don't even have to ask follow-up questions because all the follow-up questions that I was like, oh, I wonder how she does this and I wonder what the next step is. You've already answered all of those things. So it's fantastic. And I agree, like just it is a very difficult. And I mean, having endo is, like you said, it's a chronic illness. And
Mhm.
with people with chronic pain, it I was actually just did a recording this morning about kind of being at war with your body, right? And finding the balance between being at war with your body, but also accepting it to a certain extent and figuring out what works for you. Because, like you
Mhm.
said, what works for you is not going to work for the next person necessarily, even the next person with endo, because it's different for everybody.
Right.
But really giving yourself grace and finding that support and figuring out what support looks like for you.
Mhm.
Again, that's different for everybody, whether it's working with somebody as fantastic as you or just having a support system, whether it be, a neighbor, a friend, your sister, your mother, whatever works best for you, finding a support system is super, super important.
It can be life changing. I know for me, I've recently moved, and so my support system I had for 20 years, yeah, we're still on the phone and this, that, and the other. But even now that I'm in Arizona, I'm like in Scottsdale, I'm like, I got to build a new community. Not
Mhm.
necessarily a chronic illness community, but just a community because, yes, I can inspire myself, I can empower myself, but it's like sometimes you're going to need that positive energy from other people, and it's better to kind of have those tools in your toolbox. It's kind of like I joke about it, searching Dr. Google the night of a pain flare, not very helpful.
No.
Having the tips and tricks and knowing that, Boswellia helps, here's my CBD, here's my vaginal suppositories, here's this, that, and the other that I'm going to do, that's way more helpful, right? Before the flare hits. And it's kind of like community. If you know that you don't have a community, that you're low on energy, that you're feeling the anxiety, the depression, all of those things, bringing that community in so that when you're having a bad day, right, you have someone to speed dial. You can text someone. You
Mhm.
can, connect with me on my Instagram account, connect with Dr. Pan. Like you have to have that toolbox. And I think so many times when we know there's no cure, it's kind of like, oh, screw it. I don't even want the toolbox.
Yeah.
Why? Why does it matter?
Yeah.
But then, you want to sit back and be like, well, it must be nice. I get messages all the time. Well, it must be nice to be out and about. And I'm like, well, yeah, but I mean, I'm putting in the work. I've got the tools in my toolbox. I wasn't always out and about and hiking and biking and, dating and all of these things because I was just in turmoil. And so my goal is to really empower, educate, and motivate people that you can have an amazing life. Like you said, the tools in my toolbox may be some of the same ones that work for you, may be totally different, but the tools are available. We just have to really put the time in to find them.
Yes, 100%. So wanted to touch base on this before, we wrapped up here a little bit, but what are some of the myths about endometriosis that you've heard or people have come to you and been like, my doctor told me this. Is this true?
Right.
I'd love to hear the most juicy ones that you're like, oh my gosh.
Oh, the biggest one's the hysterectomy, right? Have a hysterectomy and it's going to cure. It's not going to cure. The big one that I talk about a lot too is I have two children, and I remember after my first baby, my doctor's like, yeah, if you just have kids, it'll clear it up. Well, I was two kids deep, and I'm like, how many children am I going to have to have? I love my kids, don't get me wrong. No, I did not have my children to take care of my endo. It was part of what I wanted. But it's like people think that pregnancy is going to cure their endo. Then you're like pregnant having an endo flare, and they're like, yeah, but it doesn't work for everybody because it doesn't work at all, right? Hysterectomies don't cure endo. Getting pregnant doesn't cure endo. And then I would say the other thing is turning off your period does not turn off endo. And that's where you bring in the synthetic birth control. Yes, sometimes it's a part of your healing journey, but that's not going to turn off your endo or cure your endo. That's probably the three biggest ones.
Nice. Yeah. And kind of going back to what we were talking about before, because it is a systemic issue, it's
Mm-hmm.
not just a reproductive issue. And that I think if you just kind of look at it in that frame, that changes everything, that changes treatment and everything.
Correct.
Yeah. Fantastic. So, what are some things that your clients can look forward to when they work with you? Like, what types of changes do they typically
Mm-hmm.
make?
One of them, like I said, that big GI issues, right? Your
Mhm.
gut is your foundation. So many times we chase, and I'll use myself as an example, right? We chase symptoms. We want something for the acne. We want something for the back pain. We want something for the bloating. But it's like, if we can get to that foundation, get that gut good and strong, bring in those nutrient dense meals, the acne, all the little things, so I really get them to stop chasing these rabbit trails, to stop chasing the symptoms, get down to the gut health. The next thing is really, I call them endo hacks, finding the hacks that work for you. Typically when you're having endometriosis issues, chronic systemic inflammation, those hacks are not just siloed to endo. There's typically other diagnoses going on, right? There may be some
Mhm.
IBS, some arthritis, all the itises, all the inflammation. So really finding what you need to do, like giving you that roadmap, giving you that blueprint so that each day you wake up, you're like, these are the things that I do to get my day started. I had a patient this morning, she does coffee enemas and she's like, oh my gosh, I feel amazing, and I'm like, that's what works for her, right? Not for everyone, but it's like she now has a tool. She actually has a blueprint now. Yes, we may pivot. Yes, we may change. A lot of guidance too when it comes to triggers as far as the food, because many of them are like, I'm vegetarian, I'm vegan, I'm keto, right? We've latched onto this title. And, it's like, once again, nothing against all of those. When I first started my healing journey, I was very strict keto, but really delving into what does nutrition look like for you? Because nutrition is food, the food is our fuel. So once again, nutrition is food. People think when nutrition, they're thinking supplements and juice cleanses and all of those things. Your
Mhm.
food is your nutrition. And so it's finding the food and the nutrition that will fuel your body, to heal your body, to heal your hormones, to heal the chronic systemic inflammation. So we spend a lot of time on that. And it really depends on what's going on systematically. I have a very, very intense, sometimes people are like, oh my gosh, so many questions. But I'm telling you, usually when there's endo, you've got some histamine issues, you may have a mold allergy, that weird, dandruff and toenail fungus that you thought was no big deal is letting me know that there's like a bacterial overgrowth in your gut. Like all of that stuff matters. So I really get all that information and then we start creating that plan. So then you're texting me, like my patient this morning, telling me that you're implementing your plan, that you're feeling good. Yes, you have your ups and downs, but it's really about finding what works for you, that
Mhm.
individualized care versus just grabbing freebies and things on social media and trying to mesh it all together and not having the testing to back that that's actually the plan that will work for you.
Yep. Yeah. And I think that support and that guided support
Yes.
is so, so important. Like you said, you can go on Dr. Google, and I don't think Dr. Google's a bad thing if you go at it with the right mindset. If you don't let it
Mm-hmm.
freak you out and go into the I'm going to die tomorrow rabbit hole,
Yes.
Dr. Google is great for you to take to somebody who can help guide you through all that information and who can help kind of shuffle all that and make light of that for you specifically.
Mm-hmm.
So that's fantastic. So Dr. LJ, I'd love to hear, how can people find you if they want to work with you, if they want to know more about you, if they want to hear about your podcast, all that fun stuff.
Yes. So my podcast, as you're on a podcast, you clearly love to listen. Would love to have you come over to the Holistic Endo Expert podcast, talking all things endometriosis, PCOS, and fibroids, everything, the financial, the mental health, the nutrition. Honey, I go all in. So we're 100% all in over there. You can also find me on Instagram, LJ's Powerhouse. That's LJS_Powerhouse. I'm sure we'll have all the links. If you want to work with me, you can click that link. I do a free discovery call just to chat more about what's going on in your world, right? Sometimes you need functional testing. I'm huge on testing rather than guessing, like I said, so that we can build a protocol. Some of you may need to do my 3, 6, 9, 12-month coaching. Others, you're like, hey, LJ, I just need the hormone rebalance, give me the down and dirty, give me the plan. And so you have different options, but I like for everyone to start on that free discovery call. You've got my Instagram for lots of free content as well. And then, yeah, if you follow me on Instagram, that definitely keeps you connected. And then you can work with me and just keep in touch with all my freebies and fun stuff.
Awesome. Fantastic. So if, as we're wrapping up, what is the one thing, one piece of advice you'd give to people struggling with endo or fibroids or PCOS?
My biggest thing is find what works for you and don't be discouraged if the first thing you try doesn't knock, all the symptoms to the curb, right? It is a process. It is a chronic illness that you will be managing for an extended period of time, typically all of your life, right? So
Mhm.
find what works for you And once again, don't be discouraged that the first day that you eat clean and your bloating doesn't leave, or the first day that you eat clean and your acne doesn't clear up. Realize that it's a chronic illness working at a deep cellular level. And so with that issue, you're going to need some deeper answers.
Yep. Fantastic. All right. Well, thank you so much again for joining me this morning and taking time out of your day. And everybody, all the links and everything will be down in the show notes. And thank you so much again for being on.
Thank you. Thanks for having me.